Everybody, thank you for joining me and for wanting to learn more about this very important topic. So we are going to look at preventing hip dysplasia. I should quantify that in puppies. and I think this is really revolutionary information that I feel strongly needs to get out there to the dog owning public, to all breeders, to all canine sports enthusiasts. There are things that you can do to minimize the risk of your dog developing hip dysplasia. So it's going to be very interesting, and I'm so glad you're here to learn this great information. So, welcome. A little bit about me. So my name is Laurie Edge-Hughes. Back up. That's me, Laurie Edge-Hughes. I am a human trained physical therapist. Yes, I'm a human, and I know how to treat humans as a physical therapist. And I've been a human physical therapist for almost a quarter of a century now. I have been treating animals for about that same period of time. I also hold a master's degree in animal physiotherapy through the University of Queensland in Australia. I have my certification in canine rehab, as well as in acupuncture. And basically, I dabbled in animals early on, when I was still in university doing my physiotherapy degree, and then more so as I came out and dabbled a little bit as I was treating humans, and then basically got more and more and more involved as the demand grew. And I ended up teaching the first course in canine, at the time it was called Canine Physical Therapy and Canine Physiotherapy, both in Canada and the United States in 1999. I taught the first course in canine physiotherapy in Australia in 2001, and then continued to teach for our association here in Canada, what is now called the Animal Rehab Division of the Canadian Physiotherapy Association. So I teach here. For 10 years, I taught for a canine rehab educational institution in the States. And at this point in time, I basically teach around the world wherever people invite me to come. And I also run an online educational platform so that other physical therapists and vet technicians who are doing canine rehab, so that they can learn more once they come out and have graduated with their certificate from many of these programs, so that they can continue to learn more in this field. So that's me. I think I look an awful lot like this woman bowing here. Anyways, and away we go. So here's what we're going to cover. So we're going to look at an overview of what is currently known about hip dysplasia. CHD is canine hip dysplasia, if you're wanting to take notes there. And we want to know what is currently done for canine hip dysplasia. We're going to go through a little bit of the evaluations that are done, and as well as then prevention and management in puppies. And that's where I think you guys are going to just go, whoa, it's going to be awesome. So, what do we know about hip dysplasia? So essentially, it is a laxity of the hip joint. So hip dysplasia can carry on and turn into osteoarthritis, but the actual definition and description of the hip dysplasia is that it's a laxity of the hip joint. And then what happens is that laxity causes abnormal stress in all of the supporting structures. So the ligaments, the joint capsule, even the muscles all around there. Okay, and the bones. So there's abnormal stresses going through there. This leads to inflammation, which is called synovitis. So it's the joint capsule becomes very inflamed and angry. It then becomes thickened as well. Then the joint starts to remodel. So there's a wearing down of the hip socket, especially the top part. There gets some bony growths come in that they're called osteophytes. And then it may actually result in a wee little fracture at that top portion of the hip socket. And all of this put together then can lead to osteoarthritic changes. So when you see a dog that has hip arthritis and there wasn't some other trauma, there is likely a good chance that he had hip dysplasia as a puppy. Okay, so let's go. Pathology here. It is important to know that all puppies are born with normal hips, but that the changes can start to be seen as early as 2 weeks of age. And if we go through what's known and research says, and going way back in time in the research, the progression for puppies with hip dysplasia from 0 to 2 months is there can be stretching of the joint ligaments in the joint capsule, so those the ones that basically hold that ball tight into the socket. And then there can be a rounding of the top part of the hip socket, and then the ball of the femur may subluxate a little bit. From 2 to 5 months, there can be greater subluxation. The joint capsule will thicken further. There's a further rounding of that hip socket. You can get cartilage degeneration of the hip socket and the femoral head, and now that's going to lead to osteoarthritis, right? An outward displacement of the femoral head, and again, more remodeling of both the ball and the socket of the hip. Then if the disease were to progress now from 5 to 9 months, more thickening of the rim of the socket, gross thickening of the joint capsule, lots of osteophytes and a real thickening and bony changing. And there can also be a filling in of the socket, so the socket isn't a nice holding place or a glove for that, the head of the femur. And abnormal bone growth of the head of the femur as well. So if we look at these pictures here, these ones I took from the OFA website, so the Orthopedic Foundation for Animals. And so here's what they have up as excellent hips. So you've got nice round ball of the femoral head, nice margins, nice rounding of the joint capsule, and then we have these progressions of mild, moderate, and severe hip dysplasia. So you can see how in these ones, this first one, the mild, it's just not as nice and round. The neck of the femur, which would be this part in here, is not nicely indented, not quite as elongated as in the excellent hips. The moderate hips, you can see here, there's even less of a socket. It seems more shallow. And the severe hips here, you can see where we talked about the bony growth, the osteophytes, the remodeling, kind of the flattening of this femoral head. So these are basically what is looked at and when we talk about hip dysplasia. Now, the history and the clinical signs. So usually, people would start to notice things in their young dog between 4 to 12 months. Or it could, an owner might not see anything until the animal was over 15 months if they had a chronic disease. But usually what happens is there's a sudden reduction in activity associated with sore hind limbs. The animal may have difficulty to rise, decreased willingness to walk, run, jump, and climb stairs. They may be stiff or lame after exercise. They may have a skinny rear end, right? So poor pelvic and thigh muscle development, and short choppy steps or a bunny hopping gait when they're running. So it just, they're running, but then they start hopping along. It's just, that's what is easier for them. Posture, you may see that they may lessen the weight on the hind legs by shifting their weight forwards. We'll see that often, and then you might see kind of a rounded back because they're shifting their weight forward. When they walk, they may sway or waddle or stagger a little bit. And their leg position, it kind of depends, but often they will have a wide base of support in order to increase stability, okay? But they may also have where they hold where their rear legs are quite close together, their femurs, the thigh bone, okay? The two of them are held closer to the midline than normal dogs and resulting in a narrow base stance. So they might be wide base stance or narrow base stance, but basically it's sort of how they are accommodating their hip pain, really. So it's not one or the other. You might see, well, you will see one or the other in a dog, but it's not a rule that it has to be wide base or narrow base. Okay, see, give you an idea of what we're looking for. Okay, so this is an internet dog. And you can see the rounding in his back. You can see he's not really extending his hips out. Oh, there's a little hop. There's your bunny hop. Okay. He's standing with a bit of a, I'm going to call that a wider stance, but he's also kind of looks like he's tucked under himself here. Okay. And there's just the second portion of this video. Okay. So just another look at him. And for lack of a better term, he looks like he's got a stick up his rear end. Okay. Oh, he spies a cat. Oh no, this might not be good for the cat. Oh, good thing the dog does not care about the cat. But you can just see how it's a very awkward, uncomfortable walk, and he's very tucked under himself. Okay. Oops. Now, there is often a history of a sudden onset of symptoms or pain. Okay, and so the question is, why would there be a sudden onset if this is this slow progression? And what they have come to realize is that there is an overloading of the rim of the socket, the top part, okay, that produces tissue fatigue, loss of tissue elasticity and contour, and eventually there can be a microfracture in that area. So not like a crack everything, but just, you know, like a little hairline fracture in through there, and that can cause a good deal of pain. So of course your animal is now more suddenly lame. So diagnostics. So traditionally your diagnosis is made by X-ray. Okay, so an X-ray would be just an extended, where's my cursor here? There, an extended hip view. Okay, and looking to see what those hips look like the pictures I showed you from the OFA. Now, there can also be a bit more of an advanced technique, so X-rays with a distraction, and this is called the pen hip. Okay, and so this here is a distractor device, and actually in Calgary here, there's a number of clinics that do pen hips for people who are interested in this, and of course there would be around the world as well, and especially in North America. But what they're looking at, so if we look here, this is a compressed view, and then they compare that to the distracted view. And so if you look at the diagram here, what they're looking at is coming with a measurement of here when the hip was compressed compared to here when the hip was distracted, and they look at that number and they divide it by the radius, and that gives you a distraction index. And then they look at that and compare it to all other dogs of the same breed. So they can look and say, well, for Mastiffs, these hips are fairly normal. But if you compare a Mastiff's hips to a Sighthound's hips, there's going to be a huge discrepancy. So they start to look at within breeds to come to a conclusion. Okay, and then there's also going to be physical evaluation, which we can talk about later. Okay, now incidence and etiology, so how it happens. So one, we know hip dysplasia is heritable, so it's an inherited trait. However, it is a polygenetic dominant trait with incomplete penetrance, which basically means it's not 100%. So yes, we know there's a genetic component, but there isn't a gene, and it's not quite so cut and dry that if mom has hip dysplasia, babies are going to have hip dysplasia, or if mom doesn't have hip dysplasia, babies aren't going to have hip dysplasia. So we know there is a heritable factor, but we're still learning. So just as a note, few genes affect primarily bones. The changes in bones merely reflect changes or issues with the soft tissues. But There was a research paper that shows that there are 3 different chromosomes that seem to be responsible for hip dysplasia in German Shepherd dogs. Okay? And that these chromosomes are involved in regulating bone formation, osteoclast activity, and chondrocyte proliferation and differentiation. Now, a couple things within this. A chromosome, okay, if you think about what the chromosomes that we all learned about when we were in high school biology, so, I have 2 X chromosomes, that's what makes me female. So a chromosome carries a lot of information on it. So, yeah, they've maybe narrowed it down to 3 chromosomes, but those 3 chromosomes might also be related to my conformation, could be related to a lot of different sorts of things, okay? And so these ones, well, they seem to be related to bone formation. Osteoclast is bone building, so they're the ones that build. Chondrocytes are what build cartilage, okay? And differentiation, so if you're a cartilage cell, it helps you differentiate to where you're going to be and what you're going to do. So it's not 100% cut and dry. This just basically takes us back to, yes, there is a heritable factor, but there is no one gene that's doing this, okay? And then just as an aside, the second researchers also did a study on hip dysplasia and elbow dysplasia and found that there were entirely different genetic traits. So even though they both carry the word dysplasia, they are not related diseases. Okay. Now, the other thing we know is that larger breeds tend to be more susceptible to hip dysplasia. The hip dysplasia is rarely seen in dogs less than 12 kilograms, and if it is, then these bony changes in the remodeling and the really abnormal hips are rarely seen. And we know that there's a huge difference in incidence. So the least incidence of hip dysplasia occurs in Borzois, 0.9%, whereas St. Bernards, nearly half of them have hip dysplasia. Now, this is as per x-rays that are submitted to OFA, so that number could be a little bit different because not all breeders submit every single dog they have for OFA, but it's a fairly good place to go from. Okay, and just an aside, these guys are also big candidates. Not as much as St. Bernards, but we do definitely see a lot of golden retrievers, Labradors, Rottweilers, German Shepherds that are unfortunately succumb to hip dysplasia as well. Now, I just want to read this to you guys. This comes from a veterinary orthopedic surgeon's textbook. So, the disease is preventable if hip joint congruity is maintained until ossification makes the acetabulum less plastic and the surrounding tissues become sufficiently strong to prevent the femoral head subluxation. Under normal circumstances, tissue strength and ossification progress sufficiently to prevent the disease by 6 months of age. So, a couple things in here. What this is saying is that if we can keep that ball and socket held nice and close together, then all the remodeling that occurs within the hip socket and the surrounding tissue, the hip socket, it won't happen, okay? And of all these tissues around, so the muscles, okay, as well as the ligaments, are strong enough to prevent that femoral head from sliding out, that we won't necessarily have the progression and development into hip dysplasia. And really what we've got to work on is trying to target puppies before they're 6 months of age. Okay? That if we can identify and work with them before that, we could potentially prevent this. So I found this quote to be very happy for me. Now, some other things, and if we get to things that I think are really exciting for owners of puppies and breeders, and is the environmental factors. So one study found that reduced muscle mass can be seen in puppies as young as 8 to 24 weeks of age. Okay, and that these puppies have a greater prevalence of developing hip dysplasia. So I think this is interesting because you look and say, okay, reduced muscle mass, chicken or the egg. Was there something that caused the reduced muscle mass, or did the reduced muscle mass cause the hip dysplasia? And either way, is there something that we could do to increase the muscle mass in order to prevent hip dysplasia? Okay, another, and actually these were 3 studies. So one found that puppies born in July to October in England had least incidence of hip dysplasia. Another one, puppies born spring and summer in Norway had the least incidence of hip dysplasia. And puppies born in autumn in New Zealand had the least incidence of hip dysplasia. So if we go the northern hemisphere countries up here, so if they are born spring, summer, or July to October, then they're likely spending a little more time outdoors on grass. They've got good footing. They're moving around. Okay. I looked up, I couldn't figure out autumn in New Zealand. So I looked up temperatures, average temperatures in New Zealand. And so the best I could figure was that it was just maybe less, because, how's this? The temperatures I found in New Zealand didn't really have a lot of places where it got below 0 as an average winter temperature. So I wondered whether puppies born in autumn spent more time outdoors on the grass as well. But that was the little bit of the outlier. So this is an interesting component. We're going to think about letting your puppies be outdoors. Okay. Now, this researcher, this Krontveit et al., Norwegian researcher, and she actually did, this was her PhD study, and there were maybe 4 or 5 papers that came out of it, and they were all looking at hip dysplasia in puppies, and it's amazing research. Kudos to her. So she found that there was a reduced rate of hip dysplasia in puppies that were allowed to have daily walks and exercise on soft ground and moderately rough terrain. Okay, so for example, puppies born on a farm and those with off-leash exercise between birth to 3 months had less hip dysplasia. Stick that in the back of your mind. Okay, another researcher reported that longer daily exercise duration was associated with lower lameness scores in dogs with hip dysplasia. Now, this isn't talking about prevention, the second study. The second study is saying if your dog has hip dysplasia, he's going to function better if you are doing more exercise, okay? Longer daily exercise. Okay, so are you putting all of this together? I hope it's like bing, 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 bing. So the number one key is fitness, is exercise, is strengthening. So I think that's exciting. Now, if we look specifically about what's out there in the literature in regards to prevention, so one is delaying spaying or neutering. So Torres de la Riva, 2013, so that's a paper, discovered that early neutered males, so if they were neutered before the age of 12 months, had almost a 10% incidence of hip dysplasia, which was double that of intact males. Now, here's a couple thoughts to that. So you have one thought that is perhaps neutering reduces the amount of testosterone and can affect their growth. I will throw in another theory, and one that looks at how this dog is strapped to the table. So of course, if they're anesthetized, they have to strap them to the table like this, and there is a potential that that could cause an issue in the sacroiliac joint. So that's where your pelvis joins the tailbone. And I'll get into more about that in a little bit. The other aspect I would think too is, let's say you are a great big, 100-pound Rottweiler, boy Rottweiler, and you've been neutered, and now we have to try and get you off that table somehow, but they're like a ginormous wet noodle. So no vet or vet tech is wanting to knowingly cause injury to an animal, but it could very inadvertently be the position that they're in or the maneuvering them when they're still groggy or under anesthetic. So we've now come to the point that any dog after any kind of surgery, that they come in for a checkup, so we can check their spine, their sacroiliac joint, their ribs, all of these sorts of things. And of course, like even for a simple, the simple spay and neuter, you would think, but I think there could be a component. And the spayed females, I'll know that's not what we're talking about. Spayed females, I think you need to start doing some abdominal exercises as a way to reduce late adult onset incontinence. Okay, but that's a whole other talk. Now, here's another study, and this one looked at lifelong diet restriction. So Smith et al. Found that limiting a dog's diet yielded signs of hip OA that came on much later in life, so at 12 years versus 6 years of age, that was affecting far fewer litter mates, 50% to 80%, as compared to dogs fed as much as they wanted. So what this is saying, if I reword it, if you limited your dog's diet, or maybe even fed them just properly, which is not what the bag says. Do not feed what your dog food bag says, okay? You've got to monitor your dog. But if you fed them less, okay, then if they're going to develop osteoarthritis, it's not going to come on till they're later in life, so maybe 12 years of age. And you also have a less chance that they're going to develop osteoarthritis at all. So this is just basically, don't have a fat puppy. Fat puppy does not help. Now, this was another part of the Krontveit study, and she found that restricting free access to the stairs was helpful. That puppies walking on stairs from birth to 3 months of age had an increased risk of hip dysplasia. Okay, so from that birth to 3 months, using the stairs could be problematic. So let's have a look at this. Perhaps some of these videos will elucidate why that could happen. So with these, we can see how, they're so stinking cute, but you can see how they struggle, okay? And the struggle isn't so bad as the failures, okay? So if we have these poor puppies that are trying to get up, they fall down, they fall backwards, okay, that can, I think it affects, again, the sacroiliac joint, but we're going to get more into that in a little bit. But I think it can be very traumatic to their little developing bodies. Oh, these poor little ones. Oh. Oh. Here is even worse because there's no traction. Oh my, oh my, oh my. That's okay. Maybe one of the safer ways to go down the stairs for a puppy. This one there's a good mama, helping the baby come down. There we go, more good mamas. Awesome. So I don't look at that and think of this as being a comedy video. I look at it and think, well, here's a reason why stairs could be detrimental to your puppy, or really a small dog. But your puppy that you're trying to prevent hip dysplasia. So 0 to 3 months, no stairs. Okay. Now, other things to note. So the screening tests that are used, so here in North America it's the OFA. Okay. Other countries, FCI, BVA, CK. Anyways, those are the evaluating the hip x-rays with the hips in extension. So, has screening for hip dysplasia and then subsequent selective breeding reduced the rates of hip dysplasia? So, no, a New Zealand study found. No, a Finland study found. And another one that looked worldwide at everything that was out there, no. So, looking for just the genetic component isn't helping reduce hip dysplasia, so that's not the number one answer. It's not the only answer. Now, here's a little bit of a different thing in here. So this was a couple studies looking at earlier radiographs and predicting osteoarthritis later in life. So one that says yes, if you use the pen hip, and that was a distraction, at 16 weeks, and they look at all the things they look at, Norberg angle and whatnot. At 32 weeks, they said, yeah, there is a correlation between laxity and osteoarthritis in the hips later in life. Another one said that yes, if you're using the pen hips, there was a 98% of dogs predicted to be susceptible to OA, developed OA by the end of life. And then when they looked at just OFA, so just looking at the score of the hip, looking at the shape of the hips, and usually they do that when a dog is 2. And what they found is that 55% of dogs that scored OFA normal at 2 years became, or rather developed, osteoarthritis by the end of life. So these studies are kind of done by people promoting pen hip. And yes, I agree, pen hip is the more objective method to go, but I still think there's more to it than looking at overall passive laxity and the whole genetic component of it. Okay, so I want to take you down this path that I think is really important. So a little bit of human stuff, a little bit of human research to make you think. Okay, so of patients with sacroiliac joint pain, and again, that's what I was saying, where your pelvis joins your tailbone in the back, your low back on either side of your low back. That's your sacroiliac joints. Okay, so people with pain there, 77% of them showed at least one abnormality on X-ray consistent with femoral acetabular impingement, which basically means pinching of the hip joint. Okay? 21% had acetabular retroversion. Now we go to the next slide to say, what the heck is acetabular retroversion? So this is basically, remember, the acetabulum is the hip socket. So when that hip socket faces in a more backwards direction, so if you think of your hips on a person, your hips come into the side of your pelvis, but if your pelvis is sitting, if your hip socket is turned just a little bit, so it's facing a little bit slightly more backwards, okay, then that would be your acetabular retroversion. Okay, so when it faces that way, if you think about, if your feet weren't touching the ground and your pelvis, your hip socket was facing a little bit more backwards, well then your hips, if you want your toes to face forward, now you've got a pinching of that hip socket, okay? Otherwise, you would have to have your feet facing out and in different directions, okay? So when you have that acetabular retroversion, okay, it correlates with the development of femoral acetabular impingement, so pinching in the hip joint, labrum tears. The labrum is like a cartilage extension that makes your hip socket deeper. Dysplasia, because people can get dysplasia too, and hip osteoarthritis. So this is really interesting. If we find this in people, okay, then, and it correlates so strongly with what we are hearing in dogs, then then how can there not be a bigger correlation? So let's go one further. Changes in acetabular orientation, so the hip socket, okay, can change its how it's oriented outwards with alterations in pelvic tilt and pelvic rotation. So your pelvic tilt, you can go forwards or backwards, so it's like you're sticking your belly out, okay, that's one way. And then if you tilt the other way so that you're standing like Pee Wee Herman, okay, that's your pelvic tilts both ways. Now, what can happen is you can get a less severe or a less dramatic bit of a rotation that happens just on one side or the other. Okay, so just one side is rotated, either forwards or backwards. Now, when there is an asymmetry between the rotation, okay, between the left and the right innominate bones, so the left side of your pelvis and the right side of your pelvis. So when they are asymmetric, we tend to find that the patient also has sacroiliac joint pain. So there's a correlation between your pelvis not being straight, I suppose, or rather there's an asymmetry in the position, and SI joint pain. And that asymmetry could alter the pelvic tilt and the rotation. And so acetabular retroversion is considered to be the result of a change in orientation of the entire one side of a pelvis, so an outwards rotation of one side of the pelvis in through there. So we look at this, okay, so that we look at this, and the theory put forth is that acetabular retroversion may be produced by sacroiliac joint dysfunction. Okay, so if we look here, this is a human pelvis, and by the size and shape of it, it'd be male, and your hip sockets you can't see because this bone is in the way, but they're just in there. Okay, your sacroiliac joints are here, your sacroiliac joint one side and the other side, and then your spine goes straight up from there. Okay, so what this paper is putting forth is that if you have a dysfunction there, so something isn't quite sitting right, not moving right, and therefore the pelvis isn't in quite the right position, that changes where your hip is able to go into the socket, and then you can get pinching, and the pinching can lead to degeneration, and that can lead to arthritis. So maybe that happens in dogs. So if we go back to dogs, the hip has a very complex development that comes from multiple centers of ossification. So basically there are the different growth plates. Okay, so you can see here these things that look like cracks are actually growth plates. Okay, so because you've got growth plates at all those different areas, it goes further to say that the hip joint can be susceptible to abnormal modeling forces that would result from abnormal pelvic muscle mass. So if you have, and the number one is going to be your glutes. So if you have weak glutes as a puppy, then you don't have normal movement in the hip, and then perhaps how the hip grows is altered, is different, is abnormal. So just as a clinical observation that I can pass along to you, I do a lot of litter evaluations. So I have got some awesome breeders that will bring me their entire litters for me to assess. And pretty much what I'm looking for is looking at their sacroiliac joint, the spine, the ribs, and I check elbows and hips and knees and all those things as well. And what I have found is that 50% of the puppies in any given litter will have some type of skeletal dysfunction, so be sacroiliac joint, spine, or ribs. And I believe that a puppy with a sacroiliac joint problem, when there is pain in your sacroiliac joint, we know this from people, you have a shutting down of the muscles that are closest to it, and that's going to be the glutes. It's called reflex inhibition. So the glutes shut down, and so now we have, here is your muscle mass, your reduced muscle mass, and the reduced muscle mass can lead to abnormal forces at the hip, which, there we go, putting it together, could lead to hip dysplasia. I would say especially, hang on there, so I would say especially if we were to think, if hip dysplasia were just genetic, it would be more predictable, and if a puppy was going to get it, it would be both hips. But that doesn't always happen. So what about these dogs that only have one hip that's really, really bad? I think this is what could be going on. I think it could be a sacroiliac joint dysfunction. So we are now very much promoters at my clinic that for breeders to bring the puppies in, and I love seeing them somewhere between 5, 7 to 8 weeks in there before they go to their new homes. Okay, and to check them out and fix whatever needs fixing, and then to keep an eye on them. So I would say you may want to have your puppy checked up by someone that does the manual evaluations and the mobilizations, such as we do at the Canine Fitness Center, either quarterly in the puppy's first year of life, or if you are expecting more from that puppy. If you're expecting that puppy to have a very active lifestyle, if you want it to be a sporting dog, a show dog, or go for long hikes with you, bring that puppy monthly. I'm serious, because they are so hard on their bodies that you cannot waste time and then growing abnormal. Okay. So in the next video, the next video, we're going to come up with our plan. And our plan, based on all this background information I gave you, one is going to be make sure that your puppies are getting assessed and treated for pelvis and lumbar spine issues. And then more of what you guys can be doing with your puppies is coordination training and body awareness training, building glute muscles, encourage free exercise, teach stairs after 3 months of age. Teach them. They can do stairs at a certain point, but you need to teach them, because we don't want them falling like those videos. Okay? Weight management, no chubby puppies, and monitor those hips throughout the first years. Okay? So that can be checkups. Excellent. I think that is good for now. So our next installment is going to be the plan for prevention. Now you've got all the brain knowledge. The next one, we're going to talk about things that you can do. So if even reading, listening, watching this has inspired you, and you think, oh my gosh, I need my puppy checked, give us a call here at the Canine Fitness Center. And that's it for this video. And until you click on to the next one, cheers.